We've all heard about preventative care, but unfortunately, in some cases, it's not covered by insurance, and that makes a huge difference in early detection, especially in breast cancer patients. Gretchen Awad is with us this afternoon from Susan G. Komen of Northwest Ohio to talk more about the work Komen does to be sure those types of screenings are possible and how you can help with that mission. Thanks for being here today.
Thank you for having me.
Absolutely. We have been hearing some things about different funding mechanisms changing and different rules coming down from the federal government. How is that impacting those preventative screenings?
Well, we're going to start to see the impact, that's for sure. With the passage of the One Big Beautiful Bill, there are anticipated, absolute cuts in Medicaid.
Yeah.
And we know that 1 in 10 cancer patients relies on Medicaid. So we're going to see an increase in uninsured folks by about $400,000, a 30% increase in uninsured Americans. And you know, this is the work that Komen does. And I want to stress, this is not a political thing. This is our mission. It's to save lives in the fight against breast cancer. And this is one of the ways we do it. So we anticipate a greater need for Komen funding.
There's going to be a lot more people coming forward and saying, hey, I need to get that mammogram. I need to get that screening. So let's talk about the importance of preventative care and the screenings. Let's talk about what happens when you get diagnosed at a stage 1 versus...
Sure.
Yeah.
Stage 1, although is a scary cancer diagnosis, understandably so, is preventative. We've been saying for years. Early detection saves lives, and that absolutely holds true. Our fear is people will put off those early stage mammogram screenings, especially those with higher risk or a family history or some other outside influence that may affect that. And that leads to a later stage diagnosis. It leads to more expensive treatments down the road, and unfortunately, it leads to a greater death rate. And that's something that, you know, we always emphasize: early mammograms. But when you are in a financially difficult position, that's something that, you know, a lot of times women kick down the road, right?
Yeah.
And so this is our fear with some of the things coming down the line, but we want to make sure that our community knows that Komen is there. So if you see your funding or your insurance affected, whether it's Medicaid, whether it's the Affordable Care Act, and you are part of that marketplace plan that they support, we want to make sure that you know how to access Komen funds. And we also want to make sure that people know when you are supporting Komen, you're supporting all of those advocacy people behind the scenes who are working to make sure, trying very hard, but working at those federal levels and state levels to ensure that people have proper, equitable health care. We believe that health care, it's a right, not a privilege. And that's something that we're just working for all the time.
And that's why it's so important that people sign up for the Race for the Cure, which is coming up in September 28th. It's a Sunday. And that's why we need you to register for it, because yeah, we love everybody to come out and support and, you know, be there for everyone, but that registration is what funds these types of services for people here in our community.
Right. You know, mammograms cost money, treatment costs money, and the other things that Komen pays for, you know, housing, childcare, transportation, those things all cost money. Yeah. While we love the big crowds, we can't pay hospital bills with crowds. We need those registration dollars and those sponsorships and fundraising dollars. That's how we pay for the services that women request of us. But I also want to stress that, you know, yes, come to Race, do that. Go to Komen.org and sign up to be an advocacy insider. Right before I got here, I got a little note saying, you know, hey, we need your support. We support the passage of Ohio Bill 271. Would you sign that you support it? It helps funding for mammograms for women with increased risk. It took less than 30 seconds. I signed up. It went directly to our state legislatures that are in my district, in my zip code. And I'm showing my support and hopefully trying to influence people who are passing these bills and, you know, making those rules to understand and listen to what Komen and our mission and what our people have to say.
Because if it's not coming from the federal government, that funding, maybe it can come from another source, you know, whether it's at the state level. Absolutely. And fundraising efforts as we see with the Race for the Cure. So we're getting ready for that, and you can get registered right now. But are you anticipating seeing, just an increased number of people coming to you all saying, I need a mammogram?
Yes, absolutely. Yeah. So I want to stress that, yes, we're probably anticipating an increase in ask, but what I love about our Northwest Ohio community and our Detroit community, because we manage that race now too, we're seeing an increase in people registering. We're so happy. People are excited. I think they understand the mission of Komen and how those registration dollars count. So we are seeing an increase in registration. We're anticipating bigger crowds. We're grateful we've had some new sponsors sign on. And if you register soon, today, within the next few weeks, we're going to mail that packet straight to your house, and you don't have to worry about picking it up on race day. You'll just get all your stuff right then and there. We couldn't make it more easier.
Yeah, done and done. So there is the address there on your screen, Komen.org/NWO Ohio race. There you go. Just write it down.
Ohio, yeah.
There you go. Just write it down and put in your calendar September 28th. You're going to be in downtown Toledo for the Race for the Cure. Thanks so much for being here.
Thank you.
Appreciate it.
Thank you.